Hello students, I am Dr. Thangabalu, Assistant Professor from Department of Orthodontics, Vinayaka Mission Sankaracharya Dental College, Salem. Today we are going to discuss about the topic on classification of malocclusion. So these are the contents we are going to see today. Definitions, various definitions of classification of malocclusions, and what is classification of malocclusion, and what is the purpose, main purpose of studying the classification of malocclusions, and various system of the malocclusions and conclusions. So first we will see about little bit introduction about the classification of malocclusion. First, we will see about the what is malocclusion. So malocclusion is a developmental conditions. Okay, in most instances, malocclusion and dental abnormalities are caused not by some pathological process, but by moderate, occasionally some distortion of the normal development. Okay, usually malocclusion is a developmental condition, but in some instances it may be caused by the distortion of a normal development. So first we have to differentiate between the malformation and deformity. So malformation describes a tissue that did not form normally from the beginning. From beginning means it's a congenitally. So from birth itself the tissue will not form properly, so that we call it as a malformation. And deformity, the word deformity to describe a tissue that initially formed normally and then failed to continue a normal development. So at birth the tissue will be normal, but it failed to develop or continue to develop in a normal, so that we call as a deformity. These are various definitions given by the authors. First, given by the Gardiner, White and Layton, he described malocclusion is a condition in which there is a departure from a normal relation of a teeth to other teeth in a same arch or teeth in the opposing arch. And second one is given by Houston in 1992. Malocclusion is an appreciable deviation from the ideal occlusion that may be considered aesthetically unsatisfactory, thus implying a condition of imbalance in relative size and position of teeth, facial bones and soft tissues. He considered that malocclusion is appreciable deviation from normal occlusion, and he also included and correlated the dental malocclusion to the facial imbalance. So he considered the facial skeletal bones also. And angle, this is the most simple definition. He described that any deviation from the ideal occlusal scheme. So whatever any simple, even a simple rotation or a crowding, that any simple deviation from the normal occlusal scheme is called as a malocclusion, is described by the angle. So what is the purpose, why we are doing the classification of malocclusion? So the classification is defined as the orderly reduction of a database to a list of patient problems according to profit. For example, patient will give a lot of complaints. They will have a lot of problems like crowding, rotation and sagittal problems, transverse crossbite. So we are just orderly reducing that all the problems into a proper list. We will have a set of database, that is a patient complaints. So we are reducing into the list. So problem list is nothing but a diagnosis, is according to profit. So a classification system is a grouping of clinical cases of similar appearance for ease in handling and discussion. It is not a system of diagnosis, method for determining diagnosis or way of defining treatment. So classification is, for example, in orthodontics we will easily classify class 1, class 2, class 3 malocclusions. Means class 1 patients will have a similar clinical features. So we are classifying for example, we have 500 cases for we are going for any camp. We can easily reduce the patient, we can easily classify the patients into different categories. So that will help to treatment planning, basically it's help for a treatment planning. Okay. So purpose is, first is a reason for classifying is for reference. So if we tell a patient is a class 2 malocclusion, then we can easily imagine the clinical features of class 2 malocclusion. So is for a reference, and there is also a reflexive or self-communication reason for a classification. We can communicate with the colleagues, our colleagues. For example, a patient had a class 2 malocclusion. So if we communicate with with your colleagues, they can easily indirectly imagine that clinical features of that particular malocclusion. So for a communication purpose, and basically for a communication purpose, and useful for the documentation of the problem. You can document the problem is for studying prevalence and severity of malocclusion in a population groups. For example, if you want to study the prevalence of malocclusion in Tamil Nadu population, so we can easily classify the patient into class 1, class 2 and class 3. So we can easily study the prevalence in which malocclusion is more in Tamil Nadu population, or you are particularly studying about the various districts. So we can easily classify the patient in a particular categories, and we know which malocclusion is more in a particular region. So we can easily concentrate that we enhance our treatment or spread our treatment in a particular region. So that will help for the, because epidemiologically it will help us to improve the quality of life in that particular region, and aids in diagnosis and treatment plan, grouping of orthodontic problems into the category. So we are classifying class 1, class 2, we are grouping that. Okay, so these are the various systems of the classification. There is a lot of classification of system. We are going to discuss about the most important classifications. Okay, I am telling about the Angles classification system. It's given in 1899 by Angles, and Simon system in 1926, and Ackerman and Profit classification in 1969, and a classification in primary dentition given by Bombs in 1959, and British standard classification of malocclusion in 1982, and Katz premolar classification in 1992. So first we will see about the angle system. So this is a first classification given in orthodontics, and still we are practicing this classification in almost all the orthodontic practices and almost all the institutes. So Angles classification of malocclusion in the 1890s was an important step in the development of orthodontics, because it was the first clear and simple definition of normal occlusion in the natural dentition. Angles postulate that the upper first molar were the key to occlusion, and upper and lower molars should be related to the mesiobuccal cusp of the upper molar occlude in the buccal groove of the lower molar. So Angles most importantly he taken a first molar. So the reason for his taking the first molar is it will erupt at the age of 6 years, and second reason is he considered first molar is more stable. Upper first molar is more stable because of the key ridge. Key ridge is nothing but a zygomatic buttress. Okay, bone of a zygomatic buttress. So first molar is more stable. So he taken a first molar into the consideration for classifying the malocclusion. So, and he given that what is a normal occlusion. So there is a 3 malocclusion, class 1, class 2, class 3, and he also given a what is normal occlusion. Normal occlusion is nothing but is same as a class 1 malocclusion, but all the teeth should be arranged, and all the teeth, both upper and lower teeth, will follow the line of occlusion. See, this is a line of occlusion. In maxilla, it will follow the fossa, central fossa, and while reaching the anterior region, it follows the cingulum of the upper teeth, and similarly on the contralateral side. In lower, it will follow the buccal cusp in the posteriors and incisal ridges in the anterior. Okay, so incisal ridges in the anterior. So this is the line of occlusion given by the angle. If all the teeth follow the line of occlusion, so that is a normal occlusion. Okay, but in class 1 malocclusion, the molar relations will be same. The mesiobuccal cusp of the upper first will occlude on the buccal groove, but the teeth will not follow the line of occlusion in class 1 malocclusion. For example, crowding and the labiolingual inclination or mesially inclined of the teeth. So if there is any small deviation in a particular any single teeth, so that is considered as a class 1 malocclusion. Remember, there is a difference between normal occlusion and class 1 malocclusion. Simple difference is class 1 malocclusion won't follow and the teeth won't, even a single teeth doesn't follow the line of occlusion, so that will come under the class 1 malocclusion. Okay, as I told earlier, class 1 malocclusion, see, the mesiobuccal cusp will occlude on the buccal groove. Similarly, the class 2 will be distobuccal cusp will occlude on the mesiobuccal groove of the lower molar. So this is the class 2 malocclusion. And class 3 is mesiobuccal cusp will occlude between the first lower molar and second lower molar. Okay, so this is a class 1, class 2, class 3 malocclusion, and in class 2 there is a division 1 and division 2. Division 1 is when there is a excessive overjet. So excessive overjet of more than 4 mm will consider as a division 1 malocclusion. See, this is, if you look at the overjet, there will be a more than a 4 mm. So we call it as a division 1 malocclusion. In division 2, the central incisor will be retroclined, and your lateral incisor will overlap the retrocline central incisor. So there will be a reduced amount of overjet. So that we call it as a division 2 malocclusion. A subdivision is nothing but disto-occlusion. For example, class 2 molar relation will be present on one side and class 1 molar relation will be present on another side. So unilaterally, if there is present any malocclusion, class 2 malocclusion, that we call it as a subdivision malocclusion. And say class 3, see your upper molar is almost in between, mesobuccal cusp is almost in between the lower first and second molar. So that is a class 3 malocclusion. So this is a very simple classification given by the angle, and there is a lot of limitation in the angle classifications. Let's see one by one. So it was not complete. It does not include a most important characteristic of the patient problems. Malocclusion, basically malocclusion is a three-dimensional problem. It's a anteroposterior, transverse and vertical. It's a three-dimensional problems. But angles malocclusion, vertical and transverse malocclusion, he didn't consider. He considered only a sagittal. It's a class 1, class 2, class 3. That is only a sagittal problem. He never considered a vertical like a deep bite, open bite and transverse cross bite. He never considered that. But he given only in a sagittal dimension. Okay. So he considered maxillary first molar is a most stable, but it's most, even though it's a stable landmark, it was later found it's not a consistent one. Even there is a chances of migrations of if there is a your upper second premolar is extracted, then your first molar will visualize into that extraction space. So that is not a stable one. So that is one of the disadvantages of the angles classification. And there is a missing maxillary first molar, then this angles classification is not applicable. And in mixed dentition we cannot apply a angles classification. So these are the various delimitations of the angles malocclusions. Okay, even though there is a lot of limitations in the angles classification, but it's considered as a widely used. It's considered widely used in every day-to-day practice, and almost all the institutes are following a angles classification. The reason is it's a more simple one and less time consuming. Simply within 10 to 15 seconds you can identify the malocclusion of the patient. So for that purpose, still it's widely considered as a most commonly used classification of malocclusion. So later on, there is a various modifications were given by the authors. For example, Lischer in 1912, he just added the neutro-occlusion, disto-occlusion and mesio-occlusion terms that he given. For example, class 1 that is a neutro-occlusion, class 2 that is a disto-occlusion, class 3 is the mesio-occlusion. Nothing but the relationship of the your lower molar to the upper molar. That's why if it is disto-occlusion is a class 2 and mesio-occlusion is a class 3. Your lower molar will be present more mesially in class 3. That is why he given that mesio-occlusion. And also he added a version to describe the wrong position of the teeth. Okay, for example, if it is a lingually placed, it's a linguoversion, labially placed, labioversion, mesially placed, mesioversion, like that he given for all the teeth. Tossivation or a twisted teeth, for example, a rotated, tossivation is nothing but a rotated teeth. So that he added that the version tossivation. So these are modifications given by the Lischer. And second one is given by devious modification in 1915. That was first initially 1899 angles given the for original classification. It was later modified. He added the modification by Lischer in 1912, and in 1915 Devious added some modification, given some modification. He given a modification to class 1 and class 3 malocclusion. For class 2 there is no modification for a classification of class 2. Class 2 malocclusion there is no modification. He given, so remember it's very important, there were no modification for class 2 malocclusion. So he given classification for class 1 and modification for class 1 and class 3. For a class 1 he given a 5 types, and for class 3 he given a 3 types. So remember this code word CPAPM means for a type 1, C is a crowded teeth, P is a labioversion. Labioversion is you can call it as a proclination. So P you can use a P, and A is a anterior crossbite, P is a posterior crossbite, and M is a mesioversion. Means your molars are mesially tilted into the extraction spaces. So these are the 5 types of modification given by the Devious for a class 1 malocclusion. So remember this code word CPAPM. C is for crowded, P is for proclination, A for anterior crossbite, P for posterior crossbite, and M for mesioversion of the molars. Okay, and modification for class 3. Remember, there is no modification for class 2, there is only a modification for class 3. So in type 1, see, if you look at the picture, there is a normal overlapping is present, both upper and lower incisors are normally overlap. And type 2, it's a edge to edge, or upper and lower incisor in a type edge to edge relationship. So this is a type 2 malocclusion. And type 3, incisors in a crossbite. Look at this, your upper incisor inside to the it's behind the cingulum of the lower incisor. So this is a type 3. So 3 modifications for class 3, and for class 1 there is a 5 types. Okay. So up to this we have seen about the angles classification and Lister modification and devious modification. Now we are moving on to the Simon's classification. So Simon's classification follow the law of canine. Okay, it was given 1926. He believed that our orbital plane should pass through the distal aspect of the canine. If it is passed through the orbital plane, pass through the distal aspect of the canine, then our arch is in a normal position. Okay, we will see that. So he considered 3 planes. First one is a Frankfurt horizontal plane, and second one is the orbital plane, and third one is a mid-sagittal plane. So according to Simon, he believes that the orbital plane passes through the distal axial aspect of the canine. This is known as a law of canine. Okay, so he believed that orbital plane should passes through the distal aspect of the canine in a normal occlusion. If our facial bones and dental arches are in a normally if it is normally positioned, the orbital plane will pass through the distal aspect of the canine according to Simon. So this is, we call it as a law of canine. So he studied in a 3-dimensionally for an antero-posterior relationship, that is front and back sagittal position. He taken an orbital plane. Look at the picture. So this is the orbital plane. In an orbital plane, he given a 2 types, that is a protraction and a retraction. When the dental arch or part of it is more anteriorly placed than the normal with respect to orbital plane, it is said to be in a protraction. See, if the dental arch is present more forwardly, so forwardly with respect to the orbital plane, okay, he considered that in a protraction. If it is a dental arch is very close to the orbital plane, that he called as a retraction. So that is for a antero-posterior plane. The second one is a mid-sagittal plane. That is a mediolateral, like transverse relations to cross-bite, like that we will study in a with relation to the mid-sagittal plane. For example, this is the mid-sagittal plane. It will be passed through the center of your face. So whenever the arch, dental arch is very close to the sagittal plane, mid-sagittal plane, we call it as a contraction, and whenever it is far away from the mid-sagittal, dental arch is far away from the dental arch, we call it as a distraction. In vertical relationship, he taken as a Frankfurt horizontal plane. Everybody knows that Frankfurt horizontal plane is a connecting of superior part of tragus to the lower part of the inferior border of the orbital rim. Okay, and in this he can relate like open bite or deep bite. Okay, whenever the dental arch, see, look at this line, whenever the dental arch is very close to the Frankfurt horizontal plane, he call it as a attraction, and whenever it is far away from the Frankfurt horizontal plane, he call it as a abstraction. The terms are very quite confusing, but if you look at the pictures, it will be more easier. So what are the advantages? The most and important advantage is that he emphasizes, Simon is emphasis on the orientation of dental arches to the facial skeleton. So he had taken an orbital plane, Frankfurt horizontal plane, and mid-sagittal plane. All planes are related to the facial skeletal bones. So he considered that dental relationship to the skeletal structures. So this he emphasizes on the relationship of the dental arches to the facial structure, skeletal structures also. So that is the most important one in this Simon's classification. Okay. In addition to this, he carefully giving a terminology to identify the problems in malposition of the teeth from the various osseous dysplasia. For example, the maxillary dental protraction, he given that it can easily differentiate from the total maxillary protraction. For example, the maxillary dental protraction means he is saying that our dental arch is forwardly placed with respect to the particular plane. If he call it as a dental protraction, total maxillary protraction means the whole, it is calling a whole maxillary arch, but instead of whole total maxillary protraction, he given a terminology maxillary dental protraction. So in this particular maxillary dental protraction, particularly saying that it's related to the dental arch, not a total maxillary arch. It's a three, even though it's a three-dimensional, the one and only limitation is a quite confusing terms. Terms are very confusing. See, for example, attraction. He is saying attraction of a dental arch is very close to the Frankfurt horizontal plane, but attraction is intrusion of maxillary teeth and extrusion is a mandibular teeth. It's a quite controversy. It can applicable for the maxillary arch, but mandibular arch don't applicable. For example, it intrusion is a attraction is intrusion of maxillary arch, but it's opposite to the mandibular arch. If you say attraction to the mandibular arch, it will come as a extrusion, not an intrusion. So it's a very quite confusing. For this reason, we are not using this classification nowadays. And third one is a Ackermann and Profit classification. It was given in 1969. So this is a three-dimensional classification. It's given by Ackermann and Profit. Remember, angles is only a one dimension only, he given in a sagittal dimension, but Ackermann and Profit given in a 3 dimension, and he given a 9 groups. He classified the malocclusion into the 9 groups. So Ackermann and Profit taken a Venn diagram. We people have studied this Venn diagram in school days. See, this is a Venn diagram. 3 circles and 1 outer circle is there. Okay, this also have a key. I will code word. I will tell later how to remember this. Okay, so he given a 9 groups. So group 1 is related to alignment. Group 1, if there is a problem in only alignment, you have to put a group 1 outside. See, remember, outside the bigger circle, that's a group 1, and group 2 is inner circle, that is a profile. You have to put a group 2 in the inner circle. So profile. If you are coming to group 2, there is a problem of alignment and problem in profile also. Okay, whenever you are going to group 3, group 4, the problem from the group 1 will be added to the particular groups. For example, in group 1 there is alignment, in group 2 along with alignment there will be profile is also added. Okay, like this group 3, group 4, group 5 up to group 9 is there. Again I will tell that there is a this is the code word APTSP, means for example group 1 is a alignment. Okay, group 2 P for profile, group 3 for a transverse problem, it's a group 3, and S for sagittal, it's for group 4, and group 5 there is a problem in vertical. So for a first 5 groups, this is a code word APTSP. Again telling, A for alignment, P for profile, T for transverse, and S for sagittal, V for vertical. So first 5 groups you can easily place that. So totally I told 9 groups. First you have to draw a bigger circle and 3 inner circles. Okay, like this. So first you have to place a group 1 on the outer circle. Group 1 is a alignment and group 2 is a profile. Along with the alignment you have to place it inside the inner circle, and group 3 you already drawn a 3 small circles. Okay, so divide that for group 3, group 4 and group 5. So group 3, see TSV I have told, transverse. For a group 4 it's a sagittal. Sagittal is that's a class 1, class 2, class 3, and for group 5 it's a vertical. I told now, open by D byte or whatever. Okay, for these 5 groups we have now there is a 5 groups. Now up to this we have studied only a 1 dimension. Okay, now we are going to study about in after up to group 5 there is only 1 dimension, and from group 6, 7, 8 there is a 2 dimension. See, this is a group 6. That group 6 is whenever the Venn diagram it's a intersection, means the both, it includes the both. For example, group 6 means it will include the transverse and sagittal. See, if there is a problem in sagittal, for example patient had a crossbite and also a class 2 malocclusion. Okay, then you have to place it in a group 6. And if it is in a group 7, see, group 7 is a combination of sagittal problems and vertical problems. So patient have a class 3 open bite, so then you have to place it in a group 7. And in group 8, it's an intersection of transverse and vertical. Okay, whenever the patient is having a cross bite and open bite, then you have to place it in a group 8. So up to these three smaller circles will indicate the two-dimensional problems in two dimension. See, if you look at these things, the bigger circle, this bigger smaller circle is there, na? Inside there is a small circle. These three cycle, first one will tell about the transverse problem, this will tell about the sagittal problem, this will tell about the vertical problem. And this, when in intersection, the intersection will tell about the two-dimensional problems. And okay, up to group 8 it will tell about the two-dimensional problem. And finally group 3 includes the problems in all three malocclusion. See, it's a intersection of all the small circles, so transverse, sagittal and vertical. So if the patient is having a multiple very severe complex problem, then you have to put it in a group 9. Okay, if there is a patient with the group 9, means he had the most almost have the all the malocclusions, all the malocclusions. So the severity or complexity of malocclusion is more. Okay, because the group 9 indicates a malocclusion in all the dimensions. Okay, so the advantages is telling about he relating that influence of dentition on profile is he considered and recorded in all three dimension. Unlike angles, he considered only in anteroposterior, but current profit is given in all the three dimension. And so for these things we are using the Ackermann and Profit classification of malocclusion. If in some cases we cannot apply a angles classification, for example when the first molar is missing, there is a developmental problem to the first molar, at that time we cannot use a angles classification, so we have to opt for the Ackermann Profit classification. Even though there is a lot of advantages, but there is a limitation. It's a very time consuming process and it's very difficult to understand. For first it will take a lot of time to understand, unlike angles classification of malocclusion, we can easily understand that angles classification of malocclusion. But in this, if you tell out the group 6, you have to imagine what is group 6. So it's a very difficult to understand and difficult to imagine, difficult to orient yourself. So there's a lot of disadvantages also there. Even though disadvantages there, but we have to classify the patient into based on the severity of malocclusion. We have to go for a Ackermann and Profit classification. Next one is a British Standard classification. It's given in 1982. This is for a incisor, British Standard incisor classification. See, if you look at this diagram, see, class 1 malocclusion is lower incisor edges will occlude on the middle part of the upper incisor, means below the cingulum. So this is a cingulum, below the cingulum of the upper incisor, we call it as a class 1 malocclusion. And class 2 malocclusion, our lower edges will be present posterior to the cingulum of the upper incisor. This is a cingulum and our lower incisor will be present more posterior. So there is a two division 1 and division 2. Division 1 is always there will be excess of overjet, more than 4 mm of overjet is present, that we call it as consider as a division 1. If it is less than 4 mm, we will consider as a div 2. See, this is a clinical pictures. If you look at this clinical pictures, the overjet will be more than 4 mm. If you look at this div 2, see, there is no overjet, but your lower incisor will be present posterior to the cingulum of the upper incisor. It's a very easy classification. And similarly, class 3 is nothing but is always a cross bite. See, your incisal edges lie anterior to the cingulum plateau of the upper incisor. The overjet is reduced or reversed. So it's a class 3. So we can add as a cross bite, anterior cross bite. So final one is a Katz premolar classification. It's also modification to angles classification. It's given in 1992. It's given by Morton Katz. So he shifted the focus from molars, canines and incisor to the region of premolars for the purpose of classifying the malocclusion. So various classification is given based on the canine. It's based on law of canine by Simons, molars, angles classification, incisors, British incisor classification. But Morton Katz shifted his focus to the premolar because said there is a chance of developmental conditions for in molars are more chances of losing a molars early due to caries. And so he considered for these reasons he shifted his focus to the premolars. In cases, so this is applicable whenever the molars is missing, you have to use a Katz's premolar classification. So this is a modification system, modification of angles classification, okay, based on the premolar occlusion. So there is also three types. So in premolar class 1, whenever it is identified when the most anterior upper premolar, so this is the most anterior upper first premolar, most anterior premolar fit exactly into the embrasure created by the distal contact of the most anterior premolar. Your first molar, this line should pass through the most distal aspect of the most anterior lower premolar. So this is a lower first premolar. This is a most anterior premolar is a lower first premolar, and in upper arch most anterior premolar is a upper first premolar. So when the most anterior upper premolar fit exactly into the distal aspect, the embrasure created by the distal aspect of the lower anterior premolar, this line should pass through the embrasure between the lower first and second premolar. So that is a perfectly fit, so that we call it as a premolar class 1 given by the Katz's. In case in class 2 malocclusion, the most anterior upper premolar, so this is the first molar, long axis of the first molar, okay, is occluding medial to the embrasure created by the distal contact of the lower first premolar. So this is the distal contact of the lower first premolar, but your upper first molar is occluding more mesially to this embrasure contact. So in this you have to add a plus sign. For example, this is the long axis and this is the line created by the embrasure. So the difference between these two lines is calculated as a difference in how much the severity of discrepancy. So for class 2 it will be in a plus sign. Similarly in class 3, the most anterior upper premolar is occluding distal to the embrasure creating by the distal contact of the most anterior premolar. So this is the first premolar, this is the embrasure, but your upper premolar is occluding most distal to the embrasure. So this difference will be in a minus sign, okay. This difference between these two lines will be in a minus sign. Remember, for class 2 it will be in a plus, the discrepancy will be calculated in a plus, and for class 3 the discrepancy will be calculated in a minus, okay. The sign difference is very, very important. So up to this we studied for the permanent teeth. Now we are seeing about the primary dentition malocclusion classification, okay. So Baum in 1959 he given a classification of malocclusion for a primary dentition. So he considered a normal relationship of upper and molar when there is a flush terminal plane. See, we take in the first and second molar. If you draw the line, it should tangent pass through the most distal aspect of the upper and lower molar, but it should be in a straight line. If it is in a straight plane, that is called as a normal relationship in a primary dentition. But if it is in a permanent dentition, then that we call it as a end-on relationship. But in primary dentition, the normal relationship is a flush terminal plane. This terminal plane is then this line. This line should be in a straight line. That is a normal relationship in a primary dentition. And if it is in a mesial step, whenever the lower molar is present mesially, so that we will call it as a mesial step. And if it is present, this line is present, this lower molar is present distally with respect to the upper incisor, that we call it as a distal step. In future, this will develop into the class 1 relationship, perfect class 1 relationship. This mesial step, there might be chances for developing into the class 3 malocclusion. In this distal step, this may chances for developing into the class 2 malocclusion. So in primary dentition, the normal relationship is a flush terminal plane. So we are concluding this topic. So classification is vital for understanding and addressing the dental malalignments. So it's a classification is very important to understand and address the dental malalignments, and it also helps orthodontists to tailor a treatment plans to individual patient needs. For a particular individual, we can easily design a treatment plans, okay. And Third one is a accepted classification, establish a common language for orthodontic communication and research. For a communication purpose, I already told, you can communicate easily with your colleagues, friends. They can indirectly visualize the clinical feature of the particular malocclusion. For that purpose, we have to study a classification of malocclusion. And advancement in a classification promise a better diagnosis and treatment in orthodontics. So it's help in diagnosis and treatment in orthodontics. So most important thing, what is the main purpose, take home message is, what is the purpose of studying malocclusion is, one is you can classifying the patient in a various categories. For example, n number, for example, you are going to camp, there is a 500 patient is there, 500 of patients are there, you can easily classify the patient into the based on the severity of malocclusion. For example, patient is having 100 patients having class 1, 200 patients having a class 2, 300 patients having class 3 malocclusion. So you can usually categorize the patient and put it into the particular classification. For studying the prevalence also, the classification of malocclusion will be very helpful. And then and most important is to communicate with your colleagues. Okay, they can indirectly visualize the clinical features of the particular malocclusion. So for these purpose and all, we have to study about the classification of malocclusion. Thank you, students.